I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. St. Lucie Recovery Works is an initiative supported by the Florida Department of Economic Opportunity. My focus is to connect the social service and treatment service providers and the judicial and law enforcement systems to the workforce development community with the goal of improving employment outcomes for people with substance use disorder. Employment provides important structure as well as meaningful purpose for all people. For people in recovery, employment supports long-term recovery associated with better quality of life, greater self-esteem, and happiness. CareerSource Research Coast programs are designed to meet the needs of businesses and individuals. Job seekers and employers can conveniently access employment, education, training, and local employment data to better inform business goals, to join me in conversations about recovery, second chance employment, and the community-based services that support these outcomes. We know that prevention is the best course of action. However, with appropriate treatment, people in recovery are making great contributions to our workforce. Addiction is a disease, not a character flaw, and recovery is possible. The good news is that 3 out of 4 people who experience addiction will eventually recover. First responders faced overwhelming adversity, stress, and danger in their daily responsibilities, which can take a toll on their physical, mental, and emotional health. Addiction can be devastating to the first responders and can affect community safety and trust. Often, first responders work within a closed, tight-knit unit, and it is important that people within those units are trained to deal with issues of addiction, mental health, and trauma from both a response perspective and as a supportive resource for fellow coworkers. We cover a lot of resources on this broadcast, so I recommend that you grab a paper and pen in case you may want to make some notes and keep some helpful information during these discussions, either for yourself or friends or family members who may be looking for resources in the community. My first guest tonight is Karyn Hurley, co-founder of One Brother, One Sister. Welcome, Karyn.
Thank you so much. I'm happy to be here.
So, can you tell us about the mission and the cause that One Brother, One Sister is founded under?
Yes, One Brother, One Sister began, and we train first responders. The idea for One Brother, One Sister is that we provide education for trauma, mental health, addictions, substance abuse, and we would certify these first responders nationally through NADAC. It's been an honor to train many first responders now. I think we're up to over 400 trained first responders.
What's NADAC?
NADAC is the National Association of Addiction and Drug Counselors.
Okay.
They're one of the largest accreditation bodies in the U.S., and we had decided rather than just coming from our company, we would actually get accreditation. So having that accreditation nationally as well as Florida Board certification gives teeth to having the certification.
Absolutely, and I'm sure you're welcomed into many communities because of that credential.
We are.
So what was the reason that you started this important organization?
Well, my background is I'm a former therapist in substance abuse and program director for several treatment centers up north in New York as well as Florida. And we had developed a course, an intervention course, to network really good people doing good work together that may not have credentials early in sobriety. And then that just flowered out farther and farther. So 3.5 years ago, my brother was a firefighter in upstate New York and killed himself.
I'm sorry.
Thank you. And when he did, I couldn't sit with it. I had to do something. I had tried to help him and couldn't. So we took the original nationally certified intervention course and we turned that over and changed it for first responders. So One Brother, One Sister now teaches a course specifically to first responders.
I know that his story was a sad one. You turned lemons into lemonade.
Yes.
So thank you for that. It's something that is so important in all of that work. Just really grateful that you were able to provide that resource. So what are the trainings that you actually provide?
So we provide a nationally certified intervention training. And that training is, like I said, we have created and developed that training with my business partner specifically for first responders.
And can you talk about what that training is? Like,
Yes.
What are some of the pieces of it? What does it look like?
We teach communication.
Okay.
Because in the brotherhood, we'll say, quote unquote, that I've learned from many first responders as well as my brother, there is not always will people listen. So what is the communication when someone doesn't want to listen? We also teach neuro-linguistic programming. That means, how do you store communication? How do you process communication? How do you disseminate and talk to another human being with the same communication skill that that person has? So we teach the levels of senses and how to connect with another human being.
And how long is a typical training session?
It is 6 hours.
So you're really able to have good results in 6 hours. People
and we've
walk
had
away
plenty.
with tools and skills. And where do you offer these valuable
So
courses?
usually the courses are offered when we're training first responders right in the departments, either fire departments, police departments. We've been invited into many departments in South Florida, as well as we're training up in Panama City, all over Florida at this point. We've been very fortunate to be able to be invited into these departments.
Right, so it's word of mouth?
We have many first responders that we work with that talk to other first responders. This course is at no cost, so...
That was going to be one of my next questions.
Okay. So I won't get ahead of you.
No, that's fine.
So
Let's
this
talk
course
about
is
it.
at no cost with first responders. My heart and my goal was to make sure there was enough education that maybe someone's life will be saved. We have had many calls come back to us already for treatment and for mental health.
So you say it's no cost. You're a nonprofit organization?
We are 501c3 nationally, and we do this all through donations.
That's the next topic. Okay, so it's donations. Who would support an organization like that?
It's quite amazing. When we worked in treatment, my business partner and I, but I was a therapist for years, so I know a lot of people in treatment. Treatment want to help first responders. They see a lot of first responders come into treatment. So it's anonymous. You just go on our website. We're so fortunate. We have a fundraiser next weekend. Mostly it's just donations that come in, and I look in the morning and I'm so happy because there's money that has come in over the weekend.
That's great. And I know, when we talked to prepare for this, you said that law enforcement, attorneys, treatment centers, it's very diverse, the support that you have, but it's also very understandable. And so it's hard for somebody in a particular industry to step outside of that industry and find the help that they need at times. And so it's a safe place that, addressing them within their brotherhood.
Well, and one of the things that we know, and right from the very beginning, is I know treatment. I've been in recovery well over 40 years.
Congratulations.
Thank you. So just celebrated 43, actually.
Oh, wow.
But one of the things that we know is I know treatment. I know being an addict. I know what it's like from that direction. I know what it's like to be a therapist. I know what it's like to develop programs. But I don't know what it's like to be a law enforcement officer.
Correct.
I don't know what it's like to be a firefighter. I'm a sibling of one. So when we train, we bring police officers in to train with us. We bring firefighters in to train with us because, you know what? A cop will talk to a cop and a firefighter will talk to a firefighter.
Right.
And they'll listen to us, and they talk about, they've given us lots of ideas about how to keep recreating our program, which we do, but we can't talk the way a police officer does or a firefighter. I can talk from my position only. So we've been very lucky to have amazing people, as your next guest attested.
So my first husband was a police officer. He was Massachusetts State Police, and I really do know firsthand what that brotherhood, sisterhood is, and how close-knit it is, how supportive it is from within, but they don't always have the tools to be able to give that skilled level of support. It's one thing to have a conversation with somebody, but you teach how to have an appropriate conversation that really will hopefully net some results.
And when you leave that day, people say, well, how can you learn something in a day?
But
when you leave that day, you take skills with you. The way that we teach, you will remember them and be able to use them.
So it's a lot of role playing, I would assume?
Not necessarily. Not necessarily.
All right.
Interaction, yes.
Okay. So we talked about how you're funded. Can you speak about Sober Life Studios? We're on the radio tonight.
Yes.
So talk about your end of it.
Sober Life Studios was formed actually with my business partner, who's an artist. He's a musician and an artist. And we sat down and we were talking about One Brother, One Sister one day and how could we raise more money. And so Scott Jones is my business partner, said, you know what, I'm going to start doing pop art. I'm going to do this. And he has now had an exhibition for his work. Okay. And 25% of everything that is sold is donated to One Brother, One Sister.
Fabulous. And then you're using it for people to be able to tell their story?
Yes. So if you are an artist or you take photographs or you paint or whatever you've used to add to your sobriety or helped you get through a really bad time or whatever that is, or just helps to relax when you can't relax, then get in touch with us because we want to talk to you about being part of this whole sober life art.
But isn't there a recording studio as well?
We have full studio.
How does that figure into it?
So when we teach people, at the end of it, because my business partner was Radio TV in New Jersey, one of the things that we offer people is come in and do a podcast. We have a full YouTube channel. So anybody who takes the course can come in and talk about their treatment center, talk about their sobriety, talk about if they work for law enforcement, if they're firefighters. And on that YouTube channel are all kinds of information for people to go and listen to and learn. And
so that's unbelievable, really, that you have this. And how would somebody find these testimonials if they wanted to?
You can go to ATC Education or network.com.
Okay, so that's ATC Education Network.com. Okay.
Or call me.
Okay. And so that's the next thing we want to talk about is how does somebody find Karyn Hurley? So you said you're on Facebook?
I'm on Facebook.
Instagram? LinkedIn?
Yes, I am under my name.
All right. So it's KarynHurley.
Correct.
And then you're okay to give out email and phone number?
I am available 24/7. So,
God bless
and
you.
I get calls from people. My whole goal in life is to help another human being. So my phone number is 786-514-0893. And my email is Karyn, Karyn, at onebrotheronesister.com.
So as somebody who is in long-term recovery and now working in the field, what are some thoughts that you feel is important to share?
I think that if we come together, each individual person comes together with whatever skill you have, and if we get together in a network of people, we're going to save lives.
I agree.
And the bottom line is there are too many people that we're losing. So if we keep coming together with whatever we do, you know, my sponsor said to me a long, long time ago, you get up in the morning, you thank God, and you say, how can you help another human being? I live my life that way. How can I help another human being? And right now, this is how we're helping.
Well, I thank you for that. I thank you for helping other people to get the skills to help another human being. Yes. Because it isn't just like it's each one teach one, really.
That's right.
Right?
That's right.
And if we keep doing that, then hopefully the wealth will spread, the support will spread, and maybe we'll start to make a dent in healing the community. Well, I thank you for your time. I thank you for your work, and I congratulate you on your anniversary.
And thank you so much for inviting me.
Yeah, we're really, really happy that you were able to join us. My next guest is Mike Galvin, retired captain from the Palm Beach Police Department. Welcome, Mike.
Welcome myself. I like being here.
Thanks for joining us tonight. I'm really grateful to have you here to help support the conversation. So you and your wife, Beverly, established the Cypress Wellness Retreat in Palm Beach County. Can you tell us about the facility and the project?
Yes, Cypress Wellness Retreat is a nonprofit sanctuary dedicated to the recovery of first responders and veterans through substance abuse syndrome there and PTSD.
A little bit of mental health.
Mental health problems and things like that. It's an underserved community, and we saw a need for this, and we decided to develop a
So I know, we talked earlier with Karyn, and, we did really acknowledge that, again, a close-knit community, because of stigma, it's not so easy for somebody to just go to a general treatment facility. So, but people usually come to you after treatment. Isn't that correct?
Yes.
Okay.
They come to us after treatment. This is where the follow-up part of life. We teach life skills and what they need to do to get beyond. One of the problems you have in the first responder community, whether you're fire, whether you're police, dispatchers, all the people that are the 911 people, I call them, is that they're a very closed society, and they're used to helping other people, and they don't ask for help for themselves. And that is a huge problem. And you got to break through that barrier. And when you break through the barrier, then it all works.
Okay. So people come to you and they stay on the property.
Yes.
And so what do you offer on the property?
We have 2.5 acres. We have enough room for 11 people, male and female. We have 2 separate houses. We're FAR certified. We have a pond that's stocked, and what we provide is a sanctuary, calm, serene sanctuary for people that are in high-stress jobs.
So you mentioned FAR certification, and I think that's very, very important to note, because we know that there are well-meaning people in the community who offer housing, because right now housing, we're on a crisis, there's no question about it, to find an affordable place to stay. So you can just imagine somebody comes out of treatment, they haven't been working because they've been in treatment, they may not have the funds necessarily, and then they end up in these, I don't know what else to call them, but flop houses, quite honestly.
Right.
And there are no supportive services, and there is really, in many cases, no sense of community. The FAR certification is the Florida Addiction Residence certification.
Right.
That means they've come in, they've inspected your property, and they've given you as a resident a credential that says that
That's
you are
correct.
a safe place, a supportive place.
Mm-hmm.
And I think that's important for people to understand, that you didn't just like open your door and say, come sleep here.
Yes.
That you actually have a certification to be able to provide that resource. And we do really want to encourage, when people are going to aftercare, that they look at the credential of the property and not get taken advantage of. So what was the reason that you started this important organization?
Well, it's funny. Here I am as a cop.
Right.
And I arrested the people that I'm dealing with right now. And I went through a radical change of mindset when I have family members that have been going through this substance abuse problem. And during that time, we, at our house, we asked my grandson, who was going through the problem, we asked my grandson, could you get some of your buddies, come over to the house and clean up our property? Like I said, it's 2.5 acres, and we wanted to put in a fence line and things like that. And he shows up with all these guys from his halfway house. Now, the first thing I tell my wife is count the silver, because I don't really trust what's going on. I'm a cop. So anyway.
You had your eyes opened for you.
Yeah.
After an experience with these young men.
They
Lovely.
worked wonderful. And then I found out they were just normal people that had a problem.
Correct.
And they're getting over the problem. Then they asked us, could we rent the small house? We have a separate guest house. And
that's where the women stay now.
That's where the women stay now.
Yeah.
And they asked us, could we rent that guest house? And I said, and again, my wife, who's very open-hearted, says, yeah, sure. And me, I'm, again, putting triple locks on the door. But it turned out to be one of the most wonderful experiences we've ever had. These men, I call them kids because, I'm older. These kids they did such a wonderful job, not only taking care of the property, but taking care of the house and redirecting their lives. I mean, matter of fact, our plumber and our electrician are former residents of that house because they were tradespeople, and I trust them.
That's why
it changed around.
That's why we do this conversation, because this is Second Chance Month, actually.
Yes.
April is Second Chance Month. Sometimes it's third and fourth and fifth chances. It doesn't always happen in the second chance, but we have to be open-hearted. We have to be open-minded, and we have to understand addiction is a disease, and it is treatable, and people do recover, and they come back and contribute to our community in these wonderful ways that you're talking about.
Oh, yes.
And so now they're helping to build this community that's a respite for people who are starting their journey. And so thank you so much for that. So what are some of the services you mentioned? You have like this fishing there, and it's just a peaceful atmosphere, but also it's kind of a family style of dining and cooking. Very much family style working of dining. Together.
We're basically, give you an idea about the property. We're 10 minutes away from the airport. It's Palm Beach International Airport.
Okay.
We have a fully stocked pond, so there's a lot of fishing going on. And we got guys that are just raving fishermen over there. It's really neat. We're pet friendly.
Okay.
Important. We're mat friendly.
Medicated assisted treatment.
There you go.
Which is not another drug.
No.
Okay, so let's talk about MAD for a second, because I feel that it's important to always. I changed my mind on that. You told me that you changed your mind as a police officer with the whole conversation. But that, in many cases, is the opportunity for somebody to start working on their behavioral change and their behavioral health. The medication just stops the craving, to allow somebody to have that time to work on behavioral change. In many cases, they wean off that medication and go on to just live totally medication-free life.
Yeah, we emphasize, the life skills, they all plan the meals together. They budget those meals together.
And you talked about nutrition too,
We do nutrition. They actually cook. We have some wonderful cooks here. I'd rather go there to eat sometimes, and my wife's a great cook. But it's a wonderful thing. We have a on-site wood shop. One of our house manager is a great woodsman,
skilled carpenter,
and he's helping those people do that. Gardening.
So the peer support, though, too. You have meetings,
yes,
right?
We peer support. Right now, we have a 911 AA meeting and Lawyers Anonymous meeting for just veterans and first responders, and we're the only one in Palm Beach County, and they meet at our house all the time.
And I heard that it was sanctioned by the Palm Beach County Sheriff's Department.
That's right.
Wow. That's a kudo. That's a huge kudo to have them step up and say, you know what, we'd rather have the meeting at your facility because it feels right. And I believe that's why they would make that.
We're also designated as a veteran safe place. VA and everybody has said, we recognize what you're doing, and
they're supportive about it.
And we're very supportive of it.
So exercise is important. And I know you talked about just the life skills pieces of like figuring out transportation and budgeting and things like that. So you do have those conversations as well.
All the time.
Yeah.
And the biggest thing I think about at Cypress is the fact that we do follow up with our people when they leave. We don't have a prescribed program where it's, hey, 10 weeks and you're gone or something like that. We've had people, we have one person there who's been there for 5 months, and he's now in college finishing his college degree. And he's actually in our house working on his degree right now.
Beautiful.
We also have people that have left. We had a Chicago police officer that just left back to Chicago and has already given us a call. He says, in 30 days I'm coming back because I need more time.
Yeah.
I'm not ready for this yet. So we do the follow-ups.
It's great that somebody can recognize that they need more time and still feel that the door is open and that they can come back.
I've had people come back many times.
And I know you've had some people there with some health concerns, but as a police officer, you had basic first aid training so that you're prepared to at least have an initial support until emergency services arrive if required. But you can triage things to keep somebody safe and healthy. So there are fees for somebody to stay there. You're a nonprofit, but
we're a nonprofit, but there are fees to stay at the house.
But I think that they're really affordable.
Yes, they got to pay out of pocket, but 100% is totally tax deductible as a medical expense because we have 24-hour oversight.
Okay.
We have someone living there 24 hours a day. We have a house manager that make sure that things are going good. It isn't like some sober homes or something like that where they just put people in and put people out. We make sure that they're monitored all the time.
How do people find you?
They find us in a couple different ways. One way is through a website, Cypress Wellness Retreat, or one word, .com. Okay. Another way they can find us is through email at cypresswretreat, or one word, at gmail.com.
And then your phone number?
And the phone number is area code 561-509-5300.
Okay. And as we said, people are welcome from all over. You said you even have somebody from Puerto Rico?
Puerto Rico.
Yeah.
Chicago. We've been in contact with people up in Buffalo, New York. So, they're all over. They're finding us somehow.
Yeah. It's typically 2 to 3 months, but if somebody needs longer or needs to come back, that's okay. And so you have accommodations for 11, 3 female and 8 male.
That's correct.
In separate buildings.
Separate buildings.
But they do dine together?
Oh, yeah. They dine together and they plan meals together. And because we're a family, that's what I said. You can't overestimate the value of family. And that they feel part of a community. And of course, this community naturally is very tight anyway.
Right.
And now you have the community as hey, we're all in this together. It makes a big difference in their recovery process.
I would agree with you. So we did speak to Karyn from One Brother, One Sister earlier.
Yeah, Karyn is great.
And what's your relationship with the organization?
Oh, I don't even remember when I met Karyn because I always feel like I know her.
Oh.
But anyway, when I met Karyn, she invited us to take her course.
Okay.
The One Brother, One Sister course in the communication skills that she talked about. It was an excellent course, and then she asked me, would you come back and explain what you do as a police officer? When I started doing that, I started roping in more cops.
Okay.
And that was a help for her, but it was also a help for me. I just think that these police officers need what Karyn was giving. I just felt that it was a very important need.
So you continue to participate in the trainings?
Continue to participate with the training with her.
I've been invited to participate, and I think the next one's in Melbourne. And
I would recommend it.
Yeah, I'm going to see if I can maneuver it into my schedule, because as I'm listening to all this, I'm thinking, I think it could help me in my personal life.
Well, I will tell you this, is that I told Karyn.
Does it help in your marital relationship?
You got to ask my wife on that one. But I can tell you this, is that I told Karyn this, is that the way you approach everything, these guys are going to be trained as good detectives.
Yes.
Because the way they approach people and talk to people is exactly the way a good detective would do it as a police officer.
So a little bit of de-escalation there?
Yeah, a lot of
de-escalation.
Yeah, a lot of
de-escalation. Okay. I know that you did recently receive your 501c3 nonprofit designation, so I guess we'll be looking forward to hearing about future fundraising events?
Oh, well, I'm not a fundraiser. That'll be my wife's thing.
All right. All right.
Me, I have a very hard time asking for money, but I can help people. I like helping people.
And so, again, I always like to ask for closing thoughts. So do you have like a message or advice or something that you'd like to share to anybody who may be listening tonight?
Yeah. If anybody knows a police officer, fireman, a dispatcher, think of 911, the whole 911. When you call 911, you talk to a dispatcher who is under pressure. Then you should have a cop or a fireman that show up. That is your first responder. Then you have an EMT that's probably picking up the pieces. Then you bring them to a hospital with an emergency nurse or doctor who is also part of the 911 community. So if you think of the 911 process, you think of the people that we're trying to help. And that is a very important concept for people to understand. We are here to help police officers and firemen and veterans. We know what you went through. We're here to help you. And we're not the general public. We are there just for
it's the safe
people.
Place. Yep.
Very specific. Yep. We're a very niche market.
Okay.
But our niche, we feel, is super, super important.
Well, thank you so much for that, and thank you for that message. I'd like to thank all my guests tonight for the very informative information they shared. These resources are so important to support the people who preserve life and provide safer communities. As I mentioned, April is Second Chance Month, and we know that 75% of adults with substance use disorder are currently in our workforce. But 3 out of 4 people will recover, and we want to encourage establishing recovery-friendly workplace initiatives to support and welcome these loyal and motivated staff members who are critical to sustaining work models and elevated outcomes. Please visit our CareerSource Research Coast website at careersourcerc.com/employer services to download our recovery-friendly workplace toolkit. This resource offers advice on keeping your organization strong with regard to employee retention, maintaining a safer work environment, and a positive workplace culture to promote healthier, happier employees. This can result in greater employee productivity. You can also register in employflorida.com as either a job seeker or an employer to connect to many support services. And then I always put my contact information out there. Anybody, whether it's recovery related, employment related, employee related, please feel free to reach out to me personally at Elyon, E-L-Y-O-N, at careersourcerc.com. If you're listening and you need help for yourself a family member, or a friend, please contact 211. You can dial 211 on your phone or go to 211.org and receive access to a wide variety of support services. They're available 7 days per week, 24 hours a day at no charge. And we also have a wonderful recovery community organization locally that can connect you to help and support. You can find help from a peer at Right Life Services, which is RITE lifeservices.org. They also distribute and provide training on the life-saving overdose reversal medication Narcan. So I like to really point out that we have all of these resources available in the community for anyone who's in need or has a family member or friend who may be in need. On May 11th, we'll have an opioid awareness summit at the Fenn Center in Fort Pierce from 8:30 to 1 with speakers from the Substance Abuse and Mental Health Services Administration, the Miami Drug Enforcement Administration, the local medical examiner's office, and more. You can find registration information at Drug Free St. Lucie on Facebook or roundtableslc.org/drugfree St. Lucie. And you can also find updates on this event and others at Facebook on facebook.com/Treasure Coast Opioid Task Force. Thank you for listening, and please tune in next month at 7 p.m. on May 22nd.